Epilepsy and pregnancy. All types of adult epilepsy are potentially teratogenic. So when you talk about anti-epileptic drugs, AED stands for anti-epileptic drugs. For the most part, think of it as being teratogenic. The couple that I walked you through for sure included your phenytoin, fetal hydantoin syndrome, and valproic acid, and walked you through a fetal type of hepatotoxicity, and then also a condition known as trigonocephaly. Valproic has specifically been associated with an increased risk of, please don't forget, there might be neurotube defects, including your encephalocele, anencephaly, or your spina bifida. Women with epilepsy, not a medication, also have a higher incidence of children with birth defects. So in general, it's a problem in pregnancy. All women of childbearing age on anti-epileptic drugs should be put on folate, please, to prevent the NTDs, neurotube defects. The anti-epileptic drug levels can fluctuate widely during pregnancy, especially your phenytoin, but obviously you want to try to avoid phenytoin at all costs in a pregnant woman. Epilepsy may improve during pregnancy, then worsen postpartum. Interesting enough, pregnancy itself could be, we've seen, research here has been taking place in terms of why seizures or epilepsy starts minimizing during pregnancy. Here's a condition known as status epilepticus. This would mean that less than 5 minutes, your patient is going into crazy seizures. To assess and stabilize ABCs, in other words, airway, breathing, and your circulation must be managed as being priority. You check your ABGs and you establish IV access because it's status. Benzodiazepines would be the drug of choice for managing status epilepticus. Your patient is suffering from these severe seizures for less than 5 minutes. It's actually been dropped in terms of how quickly it occurs. You could have phenytoin or fosphenytoin if the status continues. Prophylactically, P as in phenytoin and prophylaxis for status epilepticus will be the management of choice, but the treatment of choice is benzo. Is that clear? Please make sure you know that. Now, intubation should always be an option for you. And induced coma with barbiturates, maybe midazolam. And so when we say induced coma, now you know what that means. In other words, you want to try to, you are actually trying to, you're so worried that your patient is going to die because of these such severe, drastic seizures that apart from intubation, you're trying to induce quote-unquote coma with these sedative drugs, such as your benzos or barbiturates and such, propofol. And obviously, always, EEG is bedside monitoring. To summarize your seizures, risk factors. Well, there could be febrile, head. We walked through a long list of possible risk factors. Preventive medicine, helmets. So motorcycles, obviously helmets. Your job, and as an answer choice, would be lifestyle. And to make sure that you promote helmet wearing. Signs and symptoms, well, it depends on the seizure. Differential diagnoses, always keep in mind, is a metabolic. Was there electrolyte issues and such, infection, genetic disorder? Diagnostic workup, imaging, labs, lumbar puncture, if warranted. Remember, we walked through 2 populations of adult and children. And the treatment, AED stands for, once again, anti-epileptic drugs. We walked through those tables that are golden. And please make sure that you pay special attention to those drugs that I have elaborated on extensively. Vagal nerve stimulation, perhaps, or ketogenic type of diets.